Okay, so hi, good morning, good afternoon, and good evening, everyone, and welcome to the second SYSTAC Capacity Building webinar. I'll give a bit of a background of the webinar and what we'll be focusing on today for this exciting and interactive session. So today's session is really about how to advocate for systems thinking use in health policy and systems research and strengthening. And for those who may be new, or as a refresher, SYSTAC stands for the Systems Thinking Accelerator, and it aims to be a platform for systems thinking science and practice in health policy and systems research, a community engaged in system thinking tools and methods, and an amplifier of applied systems thinking in LMICs. So this capacity building workshops for SYSTAC really came out of a needs assessment across various regions globally. And we had our first session last week based on how do we take systems thinking from theory to practice with some case studies, and that's now available on YouTube. And today we'll be focusing on how we can shift the paradigm towards greater systems thinking for health with learnings from other sectors and fields. So we'll have first an interactive panel discussion with some speakers from different sectors, including the private sector, nonprofit, and donor community. And then we'll be hearing about how they use systems thinking in their work, but then also how they advocate for systems thinking use in their respective fields or with working with various stakeholders. This session will be moderated by Daniel Kobos, who is the project leader of the Health Systems and Health Policy Research Group at the Swiss Tropical and Public Health Institute. He'll be introducing our speakers in just a few minutes, but as a bit of a snippet or trailer, we have Dr. Susanna Hosman from the Fondation Botnar, Dr. Pavlina Pavlova from Impact Hub Zurich, and Philip van den Broek, hope I'm getting all of these names pronouncing them right, the co-founder of Shift N. And then following that, we will move into some collaborative breakout rooms where the goal will be to come together and brainstorm the learnings, how we can transfer the learnings that we saw on the panel from the other sectors and transfer them to increase the use of systems thinking for health system strengthening, health policy research, health policy and health research. And this session will be facilitated by a number of Swiss TPH and Alliance colleagues, such as Carmen Sant, who is the scientific collaborator at Swiss TPH, and myself, the scientific assistant, as well as Swiss TPH, and Daniel, who I've already introduced. During this session, we invite you to keep your videos on if you are comfortable, and then we'll come back together to discuss the main outputs of the group work. And that would wrap up the session, but on a more technical note, so we can move on, we have the chat box for all your questions. So throughout the webinar, continue to send your questions through the chat or comments or reflections, and we'll funnel those into the panel discussion. And you are welcome to also use the speaker view in your Zoom application so that you can see the speaker throughout. And now I will pass on to Aku Kwame, who is the technical officer at the Alliance for Health Systems and Policy Research at WHO, for a brief welcome.
Thanks very much, Anna, and good morning, good afternoon, good evening, colleagues. It's wonderful to see so many of you back with us this week. Last week, we had a really excellent kickoff, and I imagine that there's going to be much more excitement and energy today. I just wanted to welcome you all on behalf of the Alliance for Health Policy and Systems Research. Convening the SYSTAC, the Systems Thinking Accelerator, is something that we're really, really excited about. We're already seeing some of you have joined on Hive and are already active there. And in as much as we have the recordings of last week's webinars there, we also have other systems thinking resources, and we're looking forward to speaking more to you all there. We also just want to thank our friends at the Swiss TPH who have been leading on these capacity webinars as part of the overall Systems Thinking Accelerator, and looking forward to today's deliberations. So you're all welcome, and with that, I want to pass the floor to Daniel. Daniel, over to you.
Thank you, Aku. Thank you, Anna. And again, welcome everyone. So we have a fantastic panel of speakers today, and what we want to get out of this webinar is we want to get some ideas on how we can pitch systems thinking in our daily life, in our daily health system experience, and we thought that, well, there is some experience on health systems in the health sector, but there is plenty of experience outside of the health sector. So we thought, let's bring some of these experts to the webinar, and let's learn from them, learn from their experience, and get some ideas on how we could integrate system thinking more in mainstream in health systems all over the world. So we have a fantastic panel of speakers. As I was saying, we have 3 speakers coming from different fields and different positions at this time. So that I think this will enrich a lot the discussion. And I'm gonna go ahead and introduce them so that we can listen to them. That is the important part of this part of the webinar. Then is listening to you in the second part of the webinar, based on the discussion today. So first of all, we have one of the first speakers is Philip van der Broek. Hopefully I said that right. He's a graduate in engineering, philosophy, and urban planning, and he spent some time with big organizations, but soon he went and created in the mid-90s as a consultancy studio called Shiten. He's been working there for the last 25 years, helping companies navigating through change and complexity in their daily business. He's also part of the core faculty of sustainable peace mapping initiative embedded at the Advanced Consortium for Cooperation, Conflict, and Complexity at Columbia University. And he also he's the chair of the architecture and urban transformation at the Department of Architecture in ETH Zurich. So lots of experience and from different areas as well. Then we also have Pavlina Pavlova. She's an environmental science and sustainability expert. She's passionate to help companies get involved in the economies of future through innovation, collaboration, and project-based work. She's an entrepreneur and a non-profit activist, and she's currently co-leading the Circular Economy Transition Business Lab, powered by the Impact Hub in Switzerland. She's exciting companies and she's also exciting companies for circular product and service design. And finally, we have Susanna Hausmann. She's the Chief Program Officer at the Bodnar Foundation. And she's been working for 25 years in different areas, mainly around public health, with some parts of her life living in Tanzania and Mexico. She has a master in medical anthropology and a PhD in epidemiology. And she has extensive experience in implementation research, specializing on access to healthcare and bringing the community voice into the policymaking processes. At the foundation, she's mainly engaged with the city engagement portfolio development, with a strong emphasis on bringing young people to the forefront of urban ecosystems. So you can see that very different expertise, and hopefully we will get a nice discussion among the three of them. And just as a way of starting off this conversation, I would like to ask you about how system thinking came to your life, and how you are integrating that in your daily work, and how you use it to support either companies or NGOs or grantees in your activity. So maybe we can start from the last one, Susanna Hausmann.
Okay, thank you very much, Daniel, for the introduction, and very pleased to be actually in this panel, also to get to know new faces from different sectors. So, as Daniel said, I am working at the Fondation Bodnar, which is a philanthropic foundation, which is a donor basically, and our vision is that we want to have a world, or we want to see a world where children and young people flourish and thrive. Now, if I'm thinking about systems thinking in my job and how I came to it, I think I have been working on systems all my life, because as an epidemiologist and medical anthropologist doing a lot of transdisciplinary research, I've always come to look for, or to seek different stakeholders, to do a lot of different stakeholder assessments and thinking across the sectors. But what I would like just to very briefly or quickly introduce you to is actually something else. Specifically, I think that, you know, like if you want to advocate for system thinking, we should not only advocate to the outside, we should also advocate, and that's our belief for what we are doing. We should also advocate within our own organization. And what Fondacja Botnar is certainly conscious is that the world is VUCA, and I guess you all have heard about VUCA. So the world is volatile, it's uncertain, it's complex, it's ambiguous. The real world that we live in is networked and complex. And it's a world which is constantly evolving. So as I said, this is the pitch that needs to start, or has at the same time also to be towards the insight in the organizational structures and processes. And if I look at our team at the management office, we are extremely diverse, coming myself, public health background, anthropology, but then we also have very tough investment specialists. We have political scientists, engineers, so very, very diverse folks. And somehow there is very often a cacophony of concepts and terms and understandings. Is not always an easy thing to do. So the good thing about collective working then is that actually what we have done here at the foundation is also to start thinking about how can we structure ourselves, because everybody is a specialist in his or her own field, has a lot of experience. So the hierarchies just simply do not work. So we moved away from hierarchies, from the static categories, and we started, and it sounds very easy, but it's not. You know, it's a transformation inside of our organization where we all work according to roles and accountabilities with a lot of self-organization, connecting, linking up to others in the team and working collectively together. And the third thing about the organizational, maybe I mean, we are diverse, we have the structures, but also the third thing, which is I think very important, is that we are trying to continuously improve. We are trying to be very critical with ourselves, but not always with respect. And we are trying to be reflective and learning. So we do actually a lot of courses ourselves, you know, and everybody has basically also the freedom of doing the courses he or she wants, but we also stimulate others doing courses. And I can give you a list of very interesting courses on systems thinking. So the pitch is inside. Of course, what we are doing inside is also to the outside. And I said we are a grant-making foundation. But if I say grant maker, we are actually not a classical grant maker. What we are doing is more, we are catalyzer. We see ourselves as catalyzing partnerships. So what we are trying to do is to go away from the grant making towards facilitating the change. As I said, real world is networked and complex and continuously evolving. So what we are trying to do is not now to bring young people to jobs or educate or whatever, and that's all part of it, of course, as well, but much more we have a focus on facilitating and generating an environment where the young people can flourish and thrive, our vision. And as I said, inside, outside, you know, the boundaries are blurred. So our work or our type of working is also towards with our grantees or with our other networks to work very much in with looking at their relations, to start with observations, to start understanding or trying to understand incrementally, understanding the context, to understand the different perspective of those who are loud, but also to really see who has not been on the table now, who has the voice, could not be giving the voice now. What kind of platforms can we actually use in order to bring also those who are invisible so that they are made visible and also have a voice, but more than a voice, actually also a stake in the environment so that young people can flourish and thrive. So we are doing a lot of catalyzing the partnerships, bringing them together, connect the unconnected, reflecting together, flexibly adapting, bringing the invisible to the visible, and bringing them to the space, to the different space, the different stakeholders together. So basically what we do is to make a substratum, a fertile ground to facilitate weaving, connecting, and acting, and flexibly putting that, basically really like adaptively changing, flexibly, iteratively looking, analyzing, and reacting. So I leave it here for the introduction, and then happy to discuss further with my colleagues here on the panel. And
thank you. Thank you so much, Susanna, and thank you for the transparency from a donor, like explaining like how these internal processes at the end end up permeating to what you do externally. And I would like to come to Philippe, because you actually help companies and institutions to navigate these type of processes. And from your experience, what is their take on complexity, on systems, and the need to understand this network and to bring to the table these people that are not usually there? Like, what is in your experience, like how this works or doesn't work?
Thank you, Daniel. And thank you, Susanna, for an interesting testimonial, which is a good starting point for me to build on. It's true that in our work, we are invited into organizations, whether it's big administrations or smaller teams in private sector organizations or civil society organizations, to help them work through complex organizational or strategic challenges. That's basically our entry point into organizations. It is the case that, let's say, over the years that we've noticed that clients and sponsors, so to speak, frame their questions more and more in systems terms. So they're becoming more sensitive to complexity and to the jargon and the language that goes with that. That may or may not be a good thing from our point of view. It's perfectly fine to frame issues in terms of systemic, in a systemic frame or a systemic language, but one also has to be aware that it's not a magic wand, that it is not something, a kind of a toolbox which can be applied to complexity and then suddenly it dissolves. It is, it takes time, and as Susanna eloquently has shown, it's much more a matter of adaptively working through these issues and these complex situations. So that for us is actually, where it all comes down to. It is much less about applying certain tools than to be able to set, let's say, to support an ongoing social learning process to deal with complexity. And in that process, we can use a multitude of tools, whether it's from futures thinking, whether it's from classical systems thinking, whether it's action research. There is a multitude of areas where we can draw inspiration from. That depends on the specific setting in which we work, whether it's a short or a longer project, whether there are substantive resources or it's a very limited, or whether there are constraints in terms of resources, and also in terms of the problem-solving culture of the organization. When there is an engineering mindset, well, then we have to work with that. If there is a mindset of, let's say, playfulness and improvisation, then we can work with that. So it really depends on the setting in which we work, and we have to be adaptive in the way we do this. But in essence, it boils down to this. It's really about supporting that learning process. And so there I would like to add that questions may come in different guises, so to speak. Typically, a lot of questions are framed in terms of tools. We want to develop future scenarios. We would like to develop a causal loop diagram or a systems map, and that's perfectly fine as an entry point, and we can take it from there. Alternatively, it is also possible that people indeed who have already an organizational experience with systems thinking, they will likely phrase it more as Susanna did it. Can you help us work and learn our way through this issue? And then as a third way of entering that way of questioning, we can also tie it to our personal selves, how we as individuals and professionals position ourselves and experience complexity. So that is a level of first person action research, I would say, which we also, can support either in one-to-one coaching or in open-ended learning experiences. And so that is also a way of advocating from our point of view, is to make sure that these learning experiences, that we have those available, should people want to rely on that. So that's my first take on.
Thank you so much, Philip. And I totally see your point on the need for time, for this change in the mind, because at the end we are advocating for a change in mindset and how society, individuals and societies interact to each other. And I want to come to Pavlina now, because for some of the environmental problems we don't have time, or the time is right. We are running out of time, and we see the impact of economy on people's well-being, and that's becoming urgent. The inequities that are being created in countries, and how economies are influencing all of us. So from your experience, Pavlina, how can we deal with the need for time to settle these ideas and concepts and behaviors, and how can we facilitate and speed up that process?
Yeah, thank you. Also, thanks to my book, the co-panelists for really introducing this notion of, it's not about the tools, but it's rather how to support the process. And I see both of you, Susanna and Philip, talking about change of mindset. And this is actually what we are also trying to do. So for those of you who are not aware where the circular economy concept is, a resource efficiency concept which tries to eliminate waste as a concept at all. So what we're trying to do is to use natural resources as efficient as possible. And actually, going back to your first question, when is the first time I encountered systems thinking? Now that I know all about systems thinking, I realized that I encountered it first time back the first year in the university when I started studying biology, when I started studying natural ecosystems. And the nature actually is a perfect example of a good functioning systems thinking, or a good functioning system. This is where I get my usual inspiration, but this is also where I try always to connect and explain to my peers how important is actually systems thinking, and how important is to percept systems per se with all the different stakeholders. And now regarding your question on time, yeah, it's true, but I'm actually quite a positive person. So I don't really support this, let's say, environmental dooming way of, okay, time is gone. I'm rather trying to my peers and my stakeholders to give a chance, to give an opportunity. Well, now is the time to react. So let's engage, let's organize, let's map all the different stakeholders. Let's think for everybody. As I think one of you, Philip or Susanna, mentioned, the unheard ones. Let's try to map all the important stakeholders, and let's try to look at every single perspective for every stakeholder from the system and every participant.
Thank you so much, Pavlina. And just one question, and whoever wants to answer is welcome to answer before we go to the breakout room, because I think it could be useful. Because so all of this is about complexity and acknowledging complexity and dealing with complexity, and how do we do that? There are tools, there are approaches, but at the end, we need to be comfortable in dealing with complexity. And we live in a society where like everything must be explained in the word length of a tweet, and how can we combine like this deep understanding of the reality and what we have around with this need for quick and punchy messages in Twitter or in a journal, like academic journals or in blogs. Like, how can we combine both things? And you're welcome to answer, any of you, if you have ideas. I see Philip and Susanna, yes. So you can both answer.
Philip, go ahead.
Thank you. I'd like to also reassure, it's quite certain that indeed in a particular time frame, there is a pressure on condensing messages, which makes it not always easy to bring out the nuance when we talk about what systems thinking is and what it might do. On the other hand, what I would like to pull forward is that Pavlina was referring to the first year at university when she dived into her biology courses. I think there's a case to be made that Pavlina has encountered systems principles and experiences much earlier in her life, and I think we all have. I think in our childhood we are experts. It's a truism, but we have been experts at one stage in our life in dealing with complexity. At one point, our brain was fabulously neuroplastic, adjusting to changing circumstances on a daily basis, so to speak. This is what Ray Eisen, professor at systems in the Open University, called systemic sensibilities, and we all have them. So part of the work to be done is actually to make people aware that these systemic sensibilities are present, and that we have to acknowledge them and give them the space to be rekindled and reactivated again. And so in that sense, I think there's a genuine lever there to deal with that time constraint that we are facing, that is actually to appeal to innate capabilities that are present, I think, in every person. And yes, and to reactivate that.
Thank you, Philip. I don't know, Susanna, if you want to add?
If I can just add, I very much agree, of course, on that. And actually, Daniel, I have many more problems. Twitter is not a problem for conveying systemic thinking and principles approaches. That's actually where you can give a very nice messages which really reflect that. But where you do have difficulties is in the rigor of the scientific or of the so-called scientific publications and the requests and the language that actually is going to be used. In development projects, we talk about log frames. That's nonsense. It's not possible. Log frames, and that's a linear, like a cause-effect relationship. Social return on investment. Forget about if you do system thinking. Impacts, then factors. As an epidemiologist, everybody always talks about factors. But as soon as you do factors, then you actually isolate and separate, you control. And that's absolutely going totally in contrary on the opposite direction than system thinking. So talking about in a Twitter about a dream that the person could make out of his history, and that could be my background has been immigrant, and I have now reached whatever, is actually much more system thinking or reflecting system thinking than all these very rigorous old-fashioned publications which are supposedly science.
Wow, good for thought. A donor criticizing the log frame. That's a new thing. Thank you, Sana.
We are against log frames, but we are not yet there. So it's not even as a donor, it's not always easy.
Yeah, probably in this meeting, most of us are. Pavlina, I don't know if you want to add anything to this discussion.
Yeah, just adding to Susanna's kind of, instead of closing it to explaining what's a system thinking, maybe the tweet should be even a more opening invitation. So something like be a problem lover, or how to love problems, because this is actually how you would look for the solutions. That's from me.
Thank you so much, Pavlina. So now we are moving into the next part of the webinar. The ideas that with the ideas and the discussion that we have had so far, you take it to groups, and I'm going to hand over to Carmen so that she can explain everything, because she knows everything about this webinar and about system thinking. So she's going to lead us through the breakout groups.
Thanks so much, Daniel. And I must say, I feel almost bad to have been kind of pushing on the agenda, because I really wish we could be listening to the three panelists for hours, but we will have the time to come back and also answer other questions and thoughts. But we also really wanted to hear from our audience, what do you think are key messages, communication channels, and activities that we could use to advocate for systems thinking use in your sector? And I think that kind of also links with what Susanna, Philip, and Pavlina have been talking also about, how we need to change not only our environment, but also our own organizations and our own work. So with that, the idea is we have 10 minutes for this short kind of exercise. So I would advise keep the introductions rather short, because we kind of, otherwise we will lose time for discussions. You have been pre-assigned to the breakouts. The note takers do have a link that I will be posting here, actually, again, for everyone to kind of take notes. It will be only one note taker per team, but just to make sure everyone has the link. And we will be then, or I will be collecting some of the main points that are picked up in the slides, and then feeding them back to the panel to reflect and add your thoughts. And that we will also be checking quickly with the panel when you're all in the breakouts to make sure, if you want to join, that you also have the chance to join the session. So with that, maybe Aku, would you like to send the audience to the breakouts? There will be one person from our team in each breakout to make sure there are questions answered and solved. So have fun and see you all in 10 minutes. Great, thanks. I hope you also had an interesting conversation with the others. Welcome, everyone. I see many cameras, so I hope that means everyone was super active, engaging in conversations. And already, sorry, because I am sure you will have loved to stay for approximately 20 more minutes in this session, but we thought we should bring you back to try to make sure we finish on time, which I must disclaim we're usually quite bad at, but we're improving. So I must say, I was really impressed. So I was kind of trying to screen through all the things that were popping in the slides, and I'm gonna repost actually the link in the chat in case someone, you were stuck in the middle of a sentence or want to go back to that. But there were really interesting thoughts, and I must say, I think it was interesting to see from these outsider perspectives that there were different topics and themes are emerging in the different conversations. So there were some people talking about how to advocate for more systems thinking in funding mechanisms, and really kind of trying to ensure that it comes from that side, and the importance of systems thinking for knowledge translation. There were also some messages around sustainability, and sustainability also of programs, and ensuring that there's embedding of systems thinking tools and approaches in what we do, also kind of moving on. And I thought it was also interesting to see there were some messages saying that the time is now, and I think that was also referring a bit to Pavlina's comment on climate change, but there were also points on COVID-19 and how it has just become more evident than ever that without systems thinking approach, we just don't get anywhere. As well as referring to, or some messages referring on the importance to take a systems approach to actually achieve health equity. And on how we can do this, there were quite diverse also mechanisms, and I would strongly invite everyone to screen through everything. And if I am missing the most important point, please write it in the chat. But you mentioned ensuring that students learn about systems thinking, embedding systems thinking in curriculum, but also very different approaches on using social media, social influencers, and kind of spreading around these messages, as well as mass media. And then there was also, I thought it was interesting, this point on we need to engage one-on-one in discussions and networking, and making sure that we not only go for the mass, but also in this kind of direct conversations. And I think that referred also a little bit to policymakers, decision makers, and so on. And I'm very aware of time, but I would really like to invite our three panelists to maybe give 1 minute each, final remarks, if you have any thoughts or comments on what I just summarized before we hand over to Aku to close, give closing remarks. So maybe we can start in the order opposite to how we started at the beginning. So maybe Pavlina, would you like to go first?
Sure, thanks, Carmen. Yeah, so my takeaway from today's webinar as a whole is that systems thinking is an important process facilitator for different sectors and for engaging for complex problems. And it's not about the tools, but it's rather the understanding and the way of work that we need to process outside, but also inside of the organization. That's my main takeaway from today's discussion.
Thanks so much, Pavlina. Susanna, would you like to follow?
Yes, thank you. You know, what actually most excites me here with this panel is that there is a growing community talking about system thinking and trying to apply it, but also being very considerate and humble to say that it's not an easy thing. We don't just have, you know, easy tools, but we have a lot of possible approaches and principles that we can adhere. And I liked very much the point that it comes, you know, innate, that actually we all have a possibility to really you know, reflect back and just go a little bit beyond, unlearn a lot of the things that we already learned. I'm complaining a little bit because I think this is a very interesting discussion, but far too short. So it would be nice to deepen that. But really excited to see, you know, that we were hardly now talking about health, but we were talking about system thinking. And I think everybody can actually see, especially now also in the COVID pandemic. I think that is an eye opener, because COVID without system thinking, everybody is, I think, aware that that's just impossible to control or to tackle. So really good to see, you know, not talking of health, but having health always in the back of the head.
Thanks so much, Susanna. Indeed, and also health is kind of this broader understanding and not kind of our previous narrow health systems. And I just want to say that I really hope we can continue the conversation within the Hive and within SYSTAC. So yes, this was kind of a very snapshot, teaser of what's coming. Philip, would you like to give your final words?
Yes, thank you. Also picking up on the point that was now posted in the chat, the question, you know, what is systems thinking in effect, and we need to know before we can advocate for it. In my view, I would unpack it in 3 focal areas, which are actually linked together in one learning cycle. There's I would say the classical focus of systems literacy. There is a language, there is a science, there is a whole toolbox spread over many methodologies. There's a lot to be learned there, but it doesn't stop there. I think in this panel, in this discussion, we've also reinforced that it's a matter of personal transformation also. We really need to grow into another mindset away from the, let's say, reductionistic kind of worldview in which we have been socialized. And then it's also an organizational capability to, let's say, remain in the unknown or in the not known and in the uncertainty, and within that situation to continue to support these social learning processes. So that's, for me, are actually 3 areas in which we can invest, and they reinforce one another. So that would be my final point.
Thanks so much to the 3 of you for those very, very clear messages, and also for the active participations in the breakout rooms. I see Kathy's message on what we need is a system skill set, and I think that goes back also, Philip, to what you were just mentioning. So thanks everyone for participating in the breakout room. Sorry that we ran a bit short, but I hope this will just trigger more interest to continue engaged in this conversation. With that, Aku, I would like to hand over to you for the closing remarks, and looking forward to seeing many of you on the Hive. Thanks very much.
Thank you very much, Carmen. And I want to just thank everyone. It's been so refreshing to be here this morning. And of course, the time is not sufficient. As Carmen has said, we look forward to continuing to engaging with a lot of you. This is really just the beginning. I want to start just by thanking the panelists for such a provocative start this morning. Really sort of thoughtful comments, and a lot of themes that really complemented one another in the three perspectives. I think the one thing that I heard was this tension around time, that of course systems thinking requires time, but it's also nested within various levels. That adaptation and that change happens within the individual. That individual is seated within a broader organization, and that broader organization is of course embedded in broader cultures. And so when we're speaking about cross sectors, cross disciplines, how do we speak with one language, and how do we sort of take the best of those different languages and work with the prevailing culture? So these are questions for us. And in as much as we're trying to look at a common language, there's also the need to define what do we mean by systems thinking. And I liked very much the recent comment that, it's not necessarily a skill, it's not necessarily a toolbox approach, but it's really about how do foster these skills, and how do we reward them? So really appreciating the fact that, yes, we want to move towards more systems thinking, more systems approaches. We want to figure out how do we reward those. So Susanna's comments about, influencing how we grant make, and how that grant making can be catalytic, it can be facilitative, and how do we reward that kind of thinking? What are the metrics for it? How do we fund it? So it's not just our science, but it's also our government systems as well. I want to just let you all know about two sort of things that the Alliance is supporting that are very much related to this conversation. One is we put out every 2 years a flagship report. And so we will be launching in September our most recent flagship report, which is on learning health systems. And it takes it echoes much of what we've heard today around the adaptation, around the nesting of capacities and capabilities. And basically, how do you recognize learning as it takes place at different levels within a health system? So we've been learning from the work that we've been doing to support systems thinking in district management teams, that even though we did not start with an express objective of learning, that learning has been really critical and really core to how those teams really uptake and really sustain their practices. And the point that Philip made about the personal transformation is a critical one here. So we look forward to sharing with you our flagship report on learning health systems shortly. We also are really, really excited to launch a 5-episode limited podcast on systems thinking, and that should be launched in a few weeks. We've done that in partnership with the George Institute. And it's a 5-episode where we look at the foundations of systems thinking, the art and the science of systems thinking, how systems thinking looks like practically on ground, and also from policymakers' perspectives as well. So we look forward to sharing that with you, and for some light summer listening as well. But most importantly, you've heard us speaking about continuing these conversations online. We have, for those of you who have not already signed up, an online community where SYSTAC is continuing to meet. So if you've not signed up for that, please do. And that is where we have some systems thinking resources. We want to continue sort of thinking about these questions that have been raised here today. We also want to do some of the work around defining systems thinking. How do we apply it in health systems and policy making? How does it look different in the various regions? And so we want to do some thinking and writing together. And what is a contribution of a community of practice of systems thinking, systems thinkers? What would a theory of change look like? So this is the kind of work that we want to do together. We want to invite as many of you to engage with us there. And we will also be planning to meet on a broader level in October. These webinars that we've been having have been quite specific and closed to basically respond to the needs that were voiced in the needs assessments. And we're already seeing the rippling out of this community. And so we very much want to see us expanding and growing bigger, and looking forward to many of you joining us in October as well. So I want to thank the panelists. I want to thank the regional institutions who are present here today and who've done the hard work in terms of those consultative processes and trying to figure out what is the need for systems thinking in government, in civil society and health systems in the various regions where we're working. I want to also thank SYSTAC, who's been taking us through this capacity stream. And in addition to these webinars, they are also going to be packaging some resources for us as well, so we can look forward to that. I want to thank my colleagues at the Alliance who have supported all of the backroom work that has allowed us to bring these webinars to you. And of course, I want to thank everyone who is here today for your questions, for your thoughts, for your passion, and for your commitment to us pushing the agenda of systems thinking going forward. So looking forward to seeing you all. And Carmen, let me give it back to you for the last word. Thanks.
Thanks so much, Aku. Anna, I think you wanted to give the last word. Sorry about that.
Yeah, for sure. So thanks so much, Aku, and everyone. And I echo a lot of what Aku said, and thanking the panelists, the Alliance, and our SYSTAC colleagues, and of course the audience for such an engaging conversation. And it's now the top of the hour, but we will be sticking around for a few more minutes where people can just either trickle out or stay for a few minutes to discuss any last reflections or questions with us. And then also, like Carmen mentioned in the chat, you can also add to the slides, as we'll be looking at those when we're developing and consolidating what came out of this webinar for that brief that Aku described. So thanks so much, everyone, and have a great Monday and rest of your week.
Thank you, everyone.
Thanks so much. And for those that want to stay, as I didn't have a chance to join, I must say, one of the breakouts, I don't know if someone wants to say something about how it was being in a breakout, and if there were any points to share. Also for the panelists, I don't know, was everything good on your end? Philip, I see you're still here.
It was short. Yeah, we were in the middle of the starting the conversation, I would say. Yeah, it would be great to engage more frequently, like and have this type of discussions. Yeah, more with more depth and more routinely, so that we can continue building this momentum.
Daniel, I couldn't agree with you more. And, you know, some of those conversations have already started on the Hive. It occurred to me that we could do some kind of journal club or some kind of series.
Yeah.
We would have to think of the frequency, whether it's every 2 weeks, whether it's once a month. But basically, you know, someone who has a question could basically put up a kind of clinic, and it could be a sort of drop-in. So these are the things that we can think about. But I absolutely agree that given the amount, the appetites for people wanting to stay and discuss, the hours that we have for these webinars are not sufficient. And so we can think through we continue that going forward.
Yes, I couldn't agree more with that. Anyone has anything else you'd like to share or comment on? No? Free? Okay. So then maybe what we can do is slowly also wrap up kind of the informal chat. Yeah, I would, oh, sorry, I see Kranti, you have a hand raised.
Hi, I just probably it's more of a reflection. I think another group had mentioned that, you know, maybe we need to introduce systems thinking already into education earlier. And I very much agree with that. There seems to be a need to early on start integrating different disciplines, even when they're being trained. And so that there is a way to understand each other's language, rather than when you're like specialists in something, and then you struggle to understand each other's language. So I just wanted to reiterate that.
Yeah, but I have this is interesting point, and but I have a comment to that, because I agree that we need to, like, system science must be introduced in, like, as part of the skill set for anyone. I don't know if university or high school or where should it be, but then it's also about how we are taught in school and at university. I can speak. I'm a doctor. How medicine is taught, at least in Spain, is totally reductionist, not looking at any other thing but biological factors and everything, like linear, like you have these symptoms, you have this diagnosis, you have this treatment, full stop. And if you bring even in for health, when you need to bring, like, all the relationship with the environment and with the behaviors, and all of that is kind of missing. It's kind of the first section of the disease that is the one that no one reads, because it's not properly described. So it's not only about, like, the concepts of system thinking and the ideas, but also, like, how you teach the different disciplines and how the assumptions that are underlying those disciplines.
I hope it's okay if I just respond to that. I come from a biomedical research background. I probably have done like 5 years of biomedical studies, and not once I came across qualitative research, which is quite surprising. And I think it's been about 10 years of work, and only now I'm discovering there is something called social sciences and qualitative research. So I think that's a pity, because all these years I could have been, actually applying systems thinking, but not until someone discovered that, we should integrate everything, that it came together.
I can so much relate to that, Granti. I must say, for me, it was exactly the same. And I still remember the first time I was in a qualitative research course, I was like, how can you extract any research? How can you publish anything with 1 or 2 interviews? Like, I just couldn't get my mind around that. And yeah, and I think often, like, systems thinking also goes a bit in line with working transdisciplinary, multidisciplinary, pluridisciplinary, but there's a lot of wording behind this, but often, yeah, we're still dragged into the direction of, we kind of end up working with similar people to us, right? So we, as systems thinkers, we end up working with systems thinkers in health, then social scientists work with themselves. And when you kind of really, we've had a few projects here and there where we've tried to really design them together, and then you end up having this, I think, Philip, you mentioned also the language, that there's a huge barrier. You not only, I think, in the years that I've been working now in global public health, I think often there's a bigger barrier in language between disciplines than between countries. So you have epidemiologists from China, South Africa, and Brazil that really kind of understand more or less each other. And sure, there's a cultural and context component, but the language is similar. But then when it comes to social scientists from the same university and then epidemiologists, it's like, yeah. So anyway, Shahid, I see you have your hand raised, so maybe we can still hear from you. And
yes, just one ask from recent. Just now, Aku has said that we are going to do need assessment. I just want to know that at which level it will be done, provincial, district, ministry level, or what will be the modality of it? Just I want to know quick. Thank you.
thanks, Shahid. Oh, sorry. Yes, Daniel?
And I think the question was for Aku, like which level of the assessment. But I think Aku was referring to an assessment that has already been done at the regional level, means like supra country, like the different WHO regions. So there were institutions trying to look for like assessing what are the needs and the opportunities in those regions in terms of systems thinking. I don't know, Aku, if you want to say anything else.
Sorry, Shahid, I didn't catch your question. If you can repeat it again, please. I'm sorry.
Okay. you just talked about need assessment of system thinking, I think. So in this context, I want to know that at which level you will be doing that ministry level or country level or intra-country, across the country, or international level, national level, and what will be the modality of it? Yes.
Yes, thank you for your question, Shahid. So as Daniel has mentioned, the regional needs assessment that I was referring to was the needs assessment for SYSTAC, which is separate from the work that has been going on in Pakistan, Botswana, and Timor-Leste. And so what we had here was we had 5 institutions spread across the various global regions who have been engaging in this process of trying to understand what do their networks of stakeholders want or need, what are the demands around systems thinking. And so those various networks have included researchers, but also policymakers and practitioners. And I think that if any of the regional institutions are still on the line, they can also respond. I see Del, but I think that Devaki and Kathy have dropped off already. And so in those regions, they conducted various consultative processes. Some of them used surveys, some of them used stakeholder mapping tools. They were supported by the Swiss TPH colleagues to do this. And the idea was just for us to get a sense. It's been very interesting that across the regions, there is some commonality. So the issues of definition come up, the issues of applying systems thinking in policymaking, so not it being so much researcher pushed, has been a need. And so today's conversation was very interesting in that regard. And now that we have this, and it really does sort of complement the work that's been going on in Botswana, Pakistan, and Timor-Leste, the idea is now for us to build on that and see how can we support this community of practice around some tangible, concrete things to do. What do we want to do together? So the theory of change comes into that. The definitional work comes into that. Some of the tools and actually capturing examples of where system thinking has been applied falls into that as well. And we hope that will actually reflect some of these findings back as part of that meeting in October. I hope, Shahid, I've answered your question.
Thank you very much. Thank you.
Thanks, Shahid. Thanks, Aku. Philip, I see your hand, so maybe I can hear from you and then proceed to closing.
Yes, I just wanted to briefly reflect on the research conundrum and the different languages that play into that. For my own purposes, for my own research, I'm actually asking myself 3 questions. And if they are answered positively, I think we have a good chance of being in a systemic realm. First of all, is the research really search? Meaning, is it open-ended? Is it not pre-formatted from the very beginning? Second question, is the research also me-search? Meaning, am I personally invested in it as a researcher? That means, has it existential density for me as a researcher? And the third one, is the research also we-search? Meaning, is it collaborative? Is it something, is it really a process of social learning that we are actually jointly engaging in? If I have a positive answer to these 3 questions, then I think there's a good chance that we will be able to engage in fruitful learning.
This is really cool. We will start applying it ourselves.
Indeed. Oh boy, I was like trying to write it down quickly before we close. Thanks so much, Philip, and thanks so much all. I must say, I'm also very positively surprised at the parallel discussion that has been going on in the chat. So this is really exciting and it's just been wonderful. So maybe, I know, well, I could definitely continue discussing for hours, but I think we should probably slowly wrap up. So just another big thanks from all of us, especially now to you, Philip, as the representative also from the panelists. I think it was absolutely wonderful and tons of food for thought from the panel as well as from the group discussion. So hoping to seeing you everyone very soon. Have a great week and keep up the energy. Bye-bye.
Start every Monday like this.
Bye.
Okay.
Thank you, everyone.
Thank you.
Bye-bye.